My concern is, you know, we've got kids out of school, and there are parents, I hear from them all the time. And these are younger children, and if you look at the cases in that age group, and again, looking at those charts, it's very, very insignificant. And I mean, I understand when you go back to school, when you bring people back to the university, we've been cooped up. Of course, we're going to see spikes. I mean, that's common sense that we're going to see this happen. And until we start doing that and get brave and continue doing that, we're not going to we're not going to have that hump where obviously when people start getting back together, we're going to have a period of time where things go up, but then you're going to go back down. But the concern I have is that if we keep holding people hostage in their homes and telling them not to send their children to school, we're going to have that. We're just pushing out the inevitable. It's going to happen at some point. And, you know, I'm looking at the children in this community that are hurting. And I don't know about the rest of the supervisors, but I hear about it all the time. And the parents that want to get back to normal, they're having to teach their own children, and the parents are at their wits' end because they're not trained as teachers. Are we going to let this go on for much longer? You know, and I understand the governor imposed these restrictions, but I think at some point we need to look at that and start pushing back and saying we've got to get these kids back to school. Teenagers, high school kids, I'm hearing about suicides. I'm hearing about suicidal children. I heard another case this morning, 15-year-old kids that are cooped up at home. And that's, I guess a question would be, what has happened with the suicide rates in Pima County over this last few months?
Mr. Chairman, Supervisor Miller, I can tell you that we've been tracking both suicides and other forms of accidental death and car accidents. And although during the month of March there appeared to be a blip in the number of self-harm related deaths that were being seen, that has not continued to be the case. I'll tell you that as a parent of a 10 and a 13-year-old, I am extremely sensitive to the need to get children back into school. I will also remind you that per the CDC data and the ADHS data, the rate of positivity among children in the state of Arizona is actually among the highest in the country. And we're still trying to figure out why that is. You are absolutely right. Very few, if any, deaths or hospitalizations are occurring in that group, but the actual sheer number of children under the age of 18 who are positive in the state of Arizona and in Pima County is substantially higher than comparable communities across the country.
And what have we been tracking any of, and I know this is probably not something we're able to track, but the people getting their children in for mental health counseling, are we, as part of our program, are we offering any kind of additional services? Because I've heard from so many parents that their children are suicidal.
Chairman Valadez, Supervisor Miller, we are not able to track how many individuals are looking for services. We have, as part of, and you can find it on the COVID-19 website, we have, as part of what the county has been pushing out and what the health department in particular has been pushing out, are the issues and resources associated with mental health and behavioral health. And you are absolutely right. Those are incredibly important, especially during a time of social isolation. I think we need to sort of thread the needle here, and that is engage in sufficient mitigation measures that are going to protect our community, but not to do so in a way that will adversely impact these youngsters.
Have we seen increased usage of these services?
I can tell you, Supervisor Miller, Chairman Valadez, I can tell you that we have heard from the behavioral health services providers who are delivering these services via telemedicine, telebehavioral health, we can tell you that there has been an uptick in the number of folks who are using these kinds of services, yes.
Is it significant?
I can't give you a statistical significance, but it is more so than before we started.
I'm just looking, when I look at these charts, you know, and I understand you're saying that the children are testing. You're talking about, when you say children, you're talking about under the age of 18. And so I'm looking this in August on these charts that were updated on August 21st. By age group, we had the hospitalizations. We showed 9 in that age group, 0 to 19, 9 hospitalization. I don't know how many, I don't see the cases. I don't see any deaths in that age group.
Chairman Valadez, Supervisor Miller, you are absolutely right. There are 0 deaths in the less than 21. Our youngest decedent was in their late 20s. And hospitalizations are fortunately low for that group. However, the infection rate, which is in the first chart of that set that you are referencing, that has cases by month, shows how many cases we had at that point. Please understand that we're updating these on a twice weekly basis. Please understand that the numbers are, that these are based on the ADHS numbers. These tie back to the ADHS numbers. And so as the ADHS numbers are being corrected, these are also being corrected. And I can tell you that for the month of August, we had 396 hospitalizations that occurred in 0 to 19-year-olds. That is a relatively modest number of hospitalizations. I'm sorry, not hospitalizations, cases. That's a relatively modest number of cases. But for instance, that is compared to 20 to 44-year-olds who had 1,140, and to 45 to 50-year-olds who had 350 cases. So very similar to the number of hospitalizations that occur for 45 to 54-year-olds.
Okay, but I guess I'm just looking at this and thinking we've got to get these kids back in school. I guess I just think it's inevitable that we're going to see an uptick when we do start poking our heads back out again and coming back out, getting together, and I think that that's something. And unfortunately, the governor is not changing his position on this, and I think we need to do it sooner rather than later because the people are really frustrated. I do hope we can get children back to school. I know we're starting to reopen, and I think as we start to reopen, we can surely expect there's going to be a little bit of an uptick, but at some point we have to get to normalcy in it and live through that. It's real unfortunate, but either that or we isolate ourselves the rest of our lives, and I really hope that we get a little more guidance from the governor that will allow these schools to open, because we have a lot of extremely frustrated parents out there. Thank you.
Mr. Huckabee and then Supervisor Villegas.
Yes, Mr. Chairman, I think the issue, and I think Dr. Garcia, and we've kind of demonstrated, is not that those who are under 18 who are infected suffer severe, say, consequences with regard to the infection. It's the fact that they pass it along to others who have comorbidity that basically leads to their either hospitalization or death.
Supervisor Villegas.
Thank you, Chair Valdez and Mr. Huckleberry. That's exactly was going to be one of my comments, that the calls that I get are thanking us for making sure that the schools aren't opening yet, and parents are, yes, it's not convenient for them, but it's a matter of life or death for them. So I think that we need to be very careful with our planning when we do reopen. We need to make sure that those cases, positive cases, have come down significantly. I have a lot of friends on Facebook, and I'm at that high-risk age, and I constantly see my friends posting about their relatives and even my friends that have contracted the disease and have died. Recently, a family who were taking precautions and invited someone into their home, and thinking that they were safe, and then they get a call that they tested positive, and they may have exposed this family, a young family with 2 children. And sure enough, they have all tested positive except for one child, but even though a young, 4-year-old tested positive. And because they were in contact with their parents, the grandparents, the 2 grandparents tested positive. And they didn't get symptoms for a long time, and then on the 14th, 15th day, they got symptoms, and since then, recently, the grandmother has passed away. And her only son is in ICU right now, in the hospital, on a ventilator. So it's still happening, and we have to face that reality. And for those that have survived, the after effects that I'm hearing about can be very significant, and we're going to have to address those after effects as well, especially with the hardest hit, the same areas that have underlying issues, and essential workers that have to go to work every day. And now they can't because of the underlying issues of the after effects. So aside from that, I want to talk about the student housing. And while I understand that we have to be, we have to do what we have to do in order to keep those cases down, and we have to test, I am disappointed that the University of Arizona has not taken better care of their off-campus housing students. They're here because the University of Arizona opened, and I believe it's their responsibility to help testing the off-campus housing. And so I would hope that the county and the city would ask them to reimburse any of the funding that's being used from our CARES Act and that they reimburse us with their CARES Act if that's doable, which I would assume it is. The fact that these students are paying $1,000 to $1,500 a bed in these luxury student housing complexes, and they are irresponsible in, not taking this serious enough. I think the University of Arizona has to step up. They have to do what other college towns are doing and suspend them or send them home. We cannot afford to have the spread any more than we already have. And so that's my response to the student housing. And while I understand that the county and the city have to do what they have to do to protect the rest of us, I honestly think that that the University of Arizona needs to be involved in this as well. And I didn't hear that they were in the statements. The positivity rate at Keno, I don't think Dr. Garcia mentioned, it's about 12-13% compared to Udall and Flowing Wells, which is at 3 to 5%. I think that's significant, and I'm glad to hear that we're moving forward with testing the hot spots and the clusters that we've been seeing all along. So I hope that we can continue to move in that direction. And the question I had was, I noticed that we have the AZ vote safe on the budget. We received funding for that. And I'm wondering, is this mostly for PPE, or is it available to pay for any other for hard-to-reach areas under these circumstances with COVID?
Mr. Huckabee.
Yes, Mr. Chairman and Supervisor Villegas, I am under the impression in talking to the recorder that it is flexible, and so that it's for anything that's necessary in order to conduct the election in a safe manner.
Okay, thank you.
Any other discussion?
Mr. Chairman,
Supervisor Miller.
I'd like to just make sure I'm clear on Supervisor Villegas was talking about the University of Arizona off-campus housing, and you're talking about suspending students. Could you explain that? Why would you suspend students?
Well, if they're not following the rules, if they're not, if they're congregating and contributing to the spread of the virus, and there are rules in place for them and they're not following them, then there should be repercussions for that.
So has it been reported or documented that they're not following?
Well, we had an uptick in cases around the university, and at a neighborhood meeting that one of my staff attended, it was noted that there were a lot of parties going on with a lot of people converging into small spaces. And so I'm sure that this is part of the reason why we have this uptick in cases right now.
Has that been communicated to the University of Arizona? Are they aware of that?
I don't know if it has or not.
If I may, Mr. Huckabee.
Yes, Mr. Chairman, it has been. I talked Friday evening to John Dudas, who's the Chief of Staff of the President, and we had a discussion with regard to assistance that the county may need as a public health agency by the University of Arizona Police Department, particularly as it relates to large parties or parties that were not complying with any of the standard requirements in excess of 50, no physical distancing, no mask, and they do have a code of conduct. And in my conversation with Mr. Dudas, he indicated that they would be enforcing the code of conduct, which includes up to expelling students.
Thank you.
Any other questions or comments? All right.
Mr. Chairman?
Supervisor Christie.
Just a thought, because the phone calls that I've been getting and the emails is that the community is really frustrated with the situation, and that they want to have a better ability to return to an open society where we conduct business, go to school, our kids are educated properly. All of the items that have been discussed previously are what would happen, and it was brought up about pushback, what would happen if we decided as a county that we were going to implement a less restrictive set of standards regarding opening schools and businesses, and the pushback would be against Governor Ducey's executive orders? I'm curious, what would be the penalties? Is it merely I shouldn't say merely, but is it a fear that we would be withheld from any funding from the state for our COVID activities? Or what would actually happen if we said, Governor Ducey, we're not going to follow your restrictive orders here. We're going to open up our schools based on this set of data, and this is why, and we're going to go ahead and do it. What would be the consequences of that?
Mr. Huckleberry.
Yes, Mr. Chairman, other than abdicating our public health obligations, we would probably not face any consequences, because it would then be up to the governor to actually impose the requirements, the standards, and the penalties.
Mr.
So,
Chairman.
Mr. Chairman, Mr. Huckleberry, that would then, the fallout from doing that would be some sort of sanctions by the governor?
Mr. Huckleberry.
Mr. Chairman and Supervisor Christie, I think if you look at all the governor's executive orders, at the very end of those, he spells out the penalties and the actions that would be taken in violating state statutes and probably other issues. And so those would all be penalties that I would assume would be enforced or could be enforced by the governor and by state agencies such as the Attorney General.
Thank you.
Supervisor Miller.
My question was answered.
All right.
Thanks.
Anybody else on this issue? All right, we've been at it for a while, so let's take a 5-minute break and we will return to the sound of the gavel.